So what we strive to do in these integrative health programs is bring in high-impact, easy-to-access, evidence-based treatments such as nutritional counseling, mind-body practices like mindfulness, meditation, yoga, stress management and relaxation techniques, and fitness instruction so that it's convenient to access alongside the rest of your care. We do have some research about what constitutes a healthy and anti-inflammatory diet, and we know that's going to be one that's centered around vegetables and fruits, whole grains, legumes, beans, healthy sources of fats like nuts and seeds, and either plant-based sources of proteins or lean animal-based sources of proteins, things like poultry and fish. And then we should really be working to eliminate or reduce sweets, sweetened beverages, red meats, and processed foods. And we've seen that an anti-inflammatory diet can help with things like mood, with energy, sleep, weight, metabolic and body composition, and also symptoms caused by inflammation. Now, if we're already there, we feel comfortable with those things, and this is what a daily or weekly, monthly diet looks like for you, then we can take it a little bit further. And I recommend increasing the amount of micronutrients and antioxidants that we're eating through our diet. We find most of our micronutrients, which are our vitamins and our minerals, through vegetables and fruits. You may find your own sweet spot between 5 and 9 servings of those combined a day. So some antioxidant-rich foods, they may be fruits like berries and apples. They may be spices like cinnamon, nuts such as pecans, and you have a lot to choose from. We do know there's a correlation between vitamin D deficiency, total vitamin D levels, and breast cancer. So do be sure to have your vitamin D level checked and supplement, especially if it's on the low side. Green tea can provide some protection against breast cancer recurrence. Compounds like catechins and flavonols and other things that have very potent antioxidant activity. And they may also work to upregulate or turn on and off genes in certain cells. Has anyone been stressed at any point in the last month? In the last 24 hours maybe? Now, being stressed for a short amount of time, a few minutes, a few hours, even a few days is okay. Our body is designed to adapt to those and then return to a balanced state after that. But when we're under chronic stress, week after week, month after month, or year after year, we can see very significant effects on our health. Increased stress for long periods of time can cause hormonal changes, elevations in hormones like cortisol and others that can make it really difficult to lose weight. We know that if we're chronically stressed, our immunity goes down and we may be more prone to minor infections. We know it contributes to diabetes, to heart disease, and also cognitive function. On the left, you can see what a normally functioning, alert, and relaxed brain looks like, and the right is our brain on stress. So you can see on the left the area in the green, which is our prefrontal cortex right behind your forehead. That area is responsible for a lot of our higher level cognitive function. So it helps us proactively regulate our thoughts, our emotions, our actions. It's what allows you to think strategically and prioritize. Now in a relaxed brain, that area is able to communicate with downstream and lower levels of your brain and helps you regulate all of those things. But when we've been stressed for a while, we preferentially and repeatedly activate lower down levels of the brain, more primitive areas of the brain. And when we do that, we actually send negative signals to that prefrontal cortex, not allowing it to function as seamlessly and making it more difficult to focus, to concentrate, to have good attention, and to regulate our thoughts, our emotions, and our actions. That activation also travels downward, and we activate our automatic nervous system or our autonomic nervous system. We kick into fight or flight here, which causes the release of hormones like adrenaline, which can directly cause increased anxiety, higher blood pressure, higher heart rate, and it can also directly cause muscle tension, which can contribute to pain. Now, I could talk forever about mindfulness, meditation, yoga, but I also want to say a couple of words about acupuncture because I get a lot of questions about it. Many acupuncturists also include herbal therapies and nutrition in their practice, but when we study it in the traditional Western scientific type of process, we're usually just referring to the needling portion rather than all of those things. And many people do find benefit from acupuncture for pain, whether it's new and acute pain or long-standing pain. Many people find benefit from acupuncture for stress relief and for improvement of sleep. And many find it helpful for side effects of treatment, things like joint pains, hot flashes, and it's recommended for the treatment of nausea and vomiting related to chemotherapy. So there are a lot of things that we can do to help with the journey, to create a structure where you can easily find these resources. Thank you so much.